isotretinoin, the use of oral retinoids, isotretinoin, has revolutionized the management of severe treatment of resistant acne and also cystic acne, and in patients with even mild acne but with severe psychological stress. So it helped us in the treatment of acne, but it has, it's like vitamin E, it has some side effects. The side effects that mimic those of chronic hypervitaminosis A syndrome. It can make chelate in about 100% of patients, chelates of varying degrees, and also in 50% of cases there is dryness of mucous membrane, cirrhosis, conjunctivitis, and pruritus, and to a lesser extent it can cause bone and joint pain, thinning of hair, headache, and accompanying systems with increased intracranial pressure, palmoplantar desquamation, and nausea and vomiting. Also, there is laboratory abnormalities like increased high triglycerides and decreased high-density lipoprotein levels with coronary, increase the risk of coronary heart disease. It is those related with longer periods of time. Also can increase liver function test and also the cholesterol. Also the issue of isotretinoin with psychiatric effects, it has been issued in 2000 with some cases of suicide and depression, but this is doubtful now, so it needs more studying. But carefully monitor the patient if there is anything suspected about depression or suicidal attempts. Also, the dose of isotretinoin usually from 0.5 to 1 milligram per kilogram per day, daily doses. Also, can be given in some cases 2 milligram per kilogram per day in severe cases or granulomatous lesions. Sometimes there is, in severe cases, it can start with marked flare of the disease. So we can start with lower dose, about 0.5 milligram or less milligram per day, and for 1 or 2 weeks. And we can also give prednisolone together with isotretinoin 1 month or 1 or 2 weeks before starting and 2 weeks after starting the isotretinoin. Isotretinoin usually given for 20 weeks, but this length is not absolute. Can be extended until the patient has good response. A second course also can be given. Better to wait for 2 to 3 months between the doses. Also, long-term remission happens with a total dose of 100 milligram to 150 milligram per kilogram of isotretinoin. It should be used it can be used actually with not only with severe acne, as we said. Laboratory monitoring is important, baseline CBC and liver function tests. Also serum triglycerides can be repeated 3 to 4 weeks and 6 to 8 weeks of starting therapy. And also if it is normal at 6 to 8 weeks, we can stop repeating during the course of the disease. And also, unless there is high risk patients, if serum triglyceride increase above 500 milligram per dl, the level should be monitored frequently. Above 700 to 800 milligram per dl should be stopped. So if triglycerides is increased into 700 to 800 milligram per dl, or the double of the starting dose, the normal level of triglyceride, the drug should be discontinued, and lipid-lowering drugs as Lipitor and others should be administered. Also, there is in severe instances, exuberant granulation tissue can occur, and if this happens, also the drug can be stopped or given glucocorticoids, systemic glucocorticoids, or also intralesion glucocorticoids to control the granulation tissue. Of course, another one very important side effect of isotretinoin is teratogenicity. It is teratogenetic, but teratogenicity does not affect, or it is not mutagenic. So it affects embryo and with a peak near the 3rd week of gestation. So there should be a double ways of contraception, oral contraceptives with condom, with spermicidal jelly. Also, we should do a serum pregnancy test before starting the treatment. Regarding to males, there is no risk of to take isotretinoin because, as we said, it's not mutagenic, so no risk to the fetus conceived by a male with taking isotretinoin. Also, mechanism of action of isotretinoin, it acts with inhibition of sebaceous gland activity. It has indirect effect on Propionibacterium acnes by decreasing the intrafollicular lipids, so it decreases the organism growth. Also, it has anti-inflammatory effect, and it affects the pattern of follicular hyperkeratinization. So this all will lead to decreased acne formation.